Hello, my name is Dr. Phil Memley, and I'm having a little series here, discussions on dental biocompatibility. One of the biggest questions I get is, if I take something out of my mouth, what could I put in my mouth that's going to be safe for me? So this raises the question, what does safety really mean? Well, what dental biocompatibility really means is the selection of something safe to put in your mouth. Now, where does this concept come from? What's the scientific basis for this? Well, when the Human Genome Project was done, what we basically found is that for the most part, we almost have identical genes for the most part. So most of us are more similar than we really realize. But the biggest difference, and what shocked the people who were in this study, was that the biggest difference is in our immune systems. So my immune system is completely different from everybody else's on this planet, which means what? Which means if something's put in my mouth, okay, whether I eat it or if something's implanted into my teeth or into my jaw, I will have a different reaction from everyone else on the planet. So the question is that reaction safe or not safe? Okay, so that being said, dental biocompatibility is a form of personalized medicine, all right? Because in personalized medicine today, we are selecting drugs or selecting materials based on how your immune system reacts to this. That being said, once the test is done, and most of these tests are done with your blood, once that test is done, you're going to get results back that either say reactive or non-reactive. Now, non-reactive means safe. What does that mean? That means, well, let's go back. Once a material is placed in my mouth, that material is not inert. That material separates, it's called dissociation. And it turns into it's ionized into what we call salts. Okay, so now these salts come into my body, and if they're safe, that means my body can detoxify these salts and eliminate them, get them out of my body. If my body can't detoxify them or eliminate them, now they're considered not unsafe, they're considered reactive. Now, what does this test show? This biocompatibility test. Well, this biocompatibility test tests roughly 90 or so dental materials that are found in the dental materials, dental chemicals that are found in the materials. Okay, so the question is, given my DNA, what's safe for me? Well, Dr. Clifford has the Clifford Consulting Biocompatibility Test. And he's done roughly over 12,000, almost 13,000 biocompatibility tests on people. And he's accumulated a lot of the data here. And different materials yield different results. So there are certain materials that a good portion of the population will be sensitive to. Now, before I get into this, let me make this statement. I hear a lot of colleagues, I hear a lot of manufacturers make statements like, this material is biocompatibility. Now, given what we scientifically know about biocompatibility, that statement can't be true. No material is 100% biocompatible. No material is 100% non-biocompatibility. We all react differently. So I'm going to give you some of the materials that are found in, here are some of the dental chemicals found in dental materials. Okay, so, and what percentage of the population will react to them? So the number one reactive element, okay, at about 97.9% is nickel. Okay, so roughly 98% of the population reacts to nickel. Number two, mercury at about 93%. Number three is aluminum at about 91%. Now, in the 80 percentile, we run into arsenic. Okay, we run into chromium. We run into cobalt. These are roughly at the 80th percentile, and yes, These are all things found in dental materials. And again, some people will be okay with them, Other people won't. Indium, which is in dental, also dental materials, about 77%. We have beryllium, which is now considered a human carcinogen, at about 74%. We have people reacting to lead, and we have people reacting to other things such as cerium, cadmium, and tannins, toluenes. All right, these are things that are found in dental materials and that you or I may personally be reactive to. So those materials should not be placed in our body. And yes, there are things on the other extreme, okay, which zirconium comes in at about 14%. So maybe 15% of the population is reacting to zirconium. And titanium has about 1% of the population reacting to it. All right, so this should give you an idea. I'm having a little discussion on this, and we're having a discussion on other aspects of biocompatibility, dental affections, and those things. So if you like this talk, I'm having other talks. I invite you to listen to them and to give me some feedback. And I hope that these are instructive and that you learn something in these 3 or 4 minutes. So thank you for your attention, and have a great and healthy day. Thank you.